And now I'm very excited to introduce to you our guest speaker, Sommer Gorn, from the Children's Hospital in Colorado. Sommer has been in clinical practice for over 21 years, and 15 of those have been dedicated to inborn errors of metabolism. She has obtained her undergraduate degree from the University of Florida and has participated in many peer-reviewed publications, clinical trials, and the development of patient-focused educational tools and programs. She is currently working with an international team of metabolic dietitians on nutrition guidelines in the management of epilepsy. She is passionate about educating and learning from others on the nutritional management of inborn errors of metabolism. And Sommer will introduce to us how she has used this product with 2 of her patients. I will just mention, however, that in the USA, this product is called PhenylAde, which you'll hear her refer to.
So now I get the opportunity to present my clinical experience with PhenylAde GMP Mix-In, which is the product here in the United States. And I'm going to start off with the first case study. So our first case is a 13-year-old female who has a diagnosis of classic PKU. Past medical history includes her diagnosis picked up on newborn screening with her highest known blood phenylalanine level of 1936.2 micromoles per liter prior to the initiation of a Phe-restricted diet. And this was at day of life 7. Since diagnosis, she has been managed very well, good adherence to her medical formula. Family has introduced a large variety of specialty low-protein foods, fruits, vegetables, and she's always done very well with it. We saw her in clinic for our usual routine follow-up, and she recalled no longer drinking her formula at school during the day. And we like to encourage our patients to drink their formula 3 to 4 times a day. And so going from the morning before school until after school was a long period of time to really go without any type of protein, and knowing that her diet at lunch, or what the foods she takes at lunch included, were very low protein, it doesn't give much protein for her brain to use during the school day. So we thought that was going to be one point we needed to address at this visit. We also noted that her current weight indicated a need for more protein, total protein in her diet. However, her BMI had increased to the 94th percentile. So she had gained a fair amount of weight since the previous assessment. And knowing that we needed to increase protein, but her BMI was at the 94th percentile, we were limited on the choices that we could add in to increase her protein to better meet her needs without adding additional calories. She also verbalized concern herself with increasing calories, but also increasing the volume. So she knew that if we needed to add more of her current formula, it would increase the volume of her formula. So she was already struggling to complete her formula, and it would be larger volumes after school or before school than what she's taking now if we needed to add more protein from her current formula. So that is when we discussed adding the PhenylAde GMP formula into her current prescription. So we offered this option as a way for increasing her medical protein intake without excessively increasing calories or formula volume for that matter. So we gave her an option of taking this formula to school in a beverage versus adding it to her formula. So in other cases, we will add it to the formula, but in this case, it was perfect to let her take a juice or any beverage that she would like to take, or even mixing it into some food if she wanted, instead of taking her traditional formula. And we find, and others may find this to be true, that sometimes our patients don't like drinking their formula at school because the smell of the formula, or even the taste, the residual smell on their breath. So we often find patients at this age also struggling to take their formula at school. So we knew this could be a good option for her that was low profile, easy to just sneak in some food and not, but while also giving her a dose of protein during her school day. So this is the top table, describes her formula prior to us adding in the mix-ins. So she was taking a mixture of PeriFlex Advanced. She was having a little small amount of a non-fat lactose-free milk. Now, this is a very small amount of milk to be adding into a formula, but for this particular patient, a lot of it came down to taste. She was used to having milk in her formula, and as we had given her more food fee allowance, she wanted to leave a very small amount of milk into her formula just from a taste standpoint. But as you can see, when you look at the breakdown of her prescription with her current weight, even adjusting for ideal body weight, her total protein was below our goal of roughly 1.1 to 1.3 grams per kilogram per day. So adjusting at her ideal body weight, she was below our goals for her. So we added in the PhenylAde GMP and were able to maintain her current formula. She did agree to go ahead and just take out that last bit of milk and see how she liked the taste, and if she could just add take up that fee from the milk and account for the fee that is contained in the PhenylAde GMP Mix-In. So we left her fee from food the same. So as you see, the fee allowance in her diet from her food was 420 milligrams or 8.4 grams of intact protein. And when we removed the milk, we didn't, all we did was basically kind of trade out the fee from the milk for the fee that's in the GMP mix-ins. But it allowed us to add another 10 grams of protein and only 42 calories. So you can see there's not a huge difference in her calories between prior to the GMP mix-ins and after. However, we were able to give her 10 more grams of protein and get closer and now meet appropriately our goal of 1.1 to 1.3 grams of protein per kilogram, and we're able to give her 1.2. So after the introduction of the PhenylAde GMP mix-in, we were able to provide a formula that appropriately met her nutrition needs, specifically her protein needs for age and gender. She began drinking formula at school. She found it very easy to mix into various liquids. Sometimes she would even mix it into some coconut yogurt. She even started taking a little bit of milk to school and then mixed it into a hot cereal in the morning. Not hot, but a warm cereal in the morning. So this allowed us to have better adherence to the full formula completion every day. Other things that we were able to consider over time with her and how her diet continued to adjust after we had started this introduction is that we were further able to reduce the PeriFlex Advance with another packet of PhenylAde GMP mix-ins and further reduce her calories. So we've made some ongoing changes since that initial introduction to reduce calories and meet her her protein needs and reduce those calories to help slow that weight gain for her.